needs to be. That was your background, right?
It was.
Okay.
It should be like.
So sometimes it wants something else. Yeah. There you go.
Yeah. Thank you.
Yeah, I was like and then he asked again, and I could tell it seems like he was trying to be helpful. So I was just like, no. They didn't really make me drunk.
Good morning, everybody. Welcome to Grand Rounds. The rounds this morning, as you can see, is the phylogenetic inferences from viral epidemics. Dr. Joy from the HIV group is going to be presenting.
Thanks very much. I think it's customary to start off with a disclosure slide, and unfortunately, I don't have anything to disclose. Don't have any large financial sums to disclose. So I'll get right into it. The United Nations has proposed these 90-90-90 targets, whereby we will reach 90% of people globally diagnosed, 90% of those on treatment, and 90% of those virally suppressed by the year 2020. As we get closer and closer to those targets, finding additional HIV positive cases and pockets of ongoing HIV transmission becomes more and more difficult. And that is a very good thing that it's becoming more difficult, but those remaining pockets can have very significant public health connotations. I need only point at what's happening in Saskatchewan right now, or what's happened in Austin, Indiana, the Ukraine. There's a lot of pockets that really result in massive public health consequences. So how are we going to find those pockets before they get into big problems like the ones I just mentioned? One way of doing that is using something called phylogenetics. And I know what you're thinking, phylogenetics, isn't that a tasty Greek food? But I'll explain what that is in much greater detail in a few minutes. First, I'm going to go through the Canadian HIV epidemic a bit. And so the epidemic in Canada varies dramatically depending on which province you look at. In British Columbia, we've largely put out the main fire of the epidemic, and we're looking for those last remaining hotspots. In some of the other provinces, it's much more like a concentrated epidemic. And so, yeah. But phylogenetics is useful no matter which epidemic stage you're at. So a bit more detail about BC. It's the third most populous province in Canada. Historically, we had the highest rates of HIV diagnoses, and then we now have the lowest, and that marked decline is attributed to the large-scale rollout of fully subsidized treatment as prevention. Now, where is British Columbia in terms of reaching our 90-90-90 targets? This is where we are. This is from Viviana de Lima, Bob Hogg, and Julio Montana. It's a work in progress. It's the most current numbers that I've seen. So we're at 83% diagnosed, 78% of those are on treatment, and 94% of those are undetectable. So we're doing well, but we've still got a long way to go before we get to reach those targets. So what is phylogenetics and phylodynamics? It is phylogenetics is basically building family trees of anything, in particular, in this case, viruses. And phylodynamics is how epidemiological and immunological processes act to shape these viral epidemics, or these viral phylogenies. And it's a complementary approach to traditional epidemiological data, and it can give us insights into how epidemics have evolved that are difficult to get otherwise. So what is a virus phylogeny? It's basically, very simply, it's a family tree of the viruses. So each of those terminal branches at the end represents an individual infection, a sequence from a virus that's drawn from an individual infection. And one thing that we can do with that is we can use the fact that the virus evolves or mutates at a constant rate to convert those branches into representing units of time. And that allows us to make time-structured inferences about what's happened. Like this. So we have an incredibly rich source of information in these trees. It still never ceases to amaze me how much information we can extract out of these tree structures. You have the distribution of nodes and branches and the times between branching events, and you can use those things to make inferences about different epidemiological quantities. An example here, well, here's a few examples: the effective population size, the basic reproductive number, or incidence. And this is an example of a plot called the Bayesian Skyline plot, and it is based on HIV, and it's showing us how the effective infected population size changed over time in India. And you can see that the exponential growth phase peaked at about 1986. But perhaps the simplest method of phylodynamic and phylogenetics applied to viral epidemics is phylogenetic clustering. And here we take advantage of the fact that HIV evolves very, very rapidly, and thus infections that retain significant genetic similarity are likely related by recent transmission events. And therefore, clusters of 5 or more genetically related infections can represent a localized outbreak that we would like to get a hold of before it becomes a problem like us in Indiana. So in this diagram, in the tree there, you have the blue circled part would be the cluster, and the rest of the sequences would be different enough that they wouldn't form a cluster. And when I say different enough, we calculate that, or we assign that in a quantitative way by measuring how much genetic distance there is in blue there between sequences drawn from the same person's infection over time and sequences drawn from different people's infections over time. And then we're able to quantitatively assign a breakpoint and use that to decide on what a cluster is. Few caveats. A network of genetic similarity is not a transmission network. And I say that because you can never exclude the chance that there's an unsampled person in between. So we can't really use this method to point our finger at any particular person, because there's always those chances that we missed somebody in an intervening chain. And that's another reason we consider this at the level of the group and of clusters 5 or more. And in British Columbia, we've developed here our first of its kind system called a near real-time phylogenetic monitoring system. And it takes advantage of the fact that we have a database, a very large database of all of the HIV sequences from the province, representing nearly 75% of the estimated prevalence. And all of these things are conveniently linked to clinical, demographic, and epidemiological data. And the data is all de-identified prior to analysis. And so importantly, the phylogenetic tree of the British Columbia epidemic is regenerated on a daily basis, and those clusters are tracked on a daily basis. And so we're currently tracking, actually more than that, we're tracking over 200 clusters. This is sort of a schematic of what the system looks like. You have a database, a restricted view of that database, a query that goes to a processor, builds the trees on the computing cluster, and then it's the reports that are sent to public health people are generated using LaTeX. So this is what it looks like when you look at all of the clusters in British Columbia at once. And depending on whether you're a glass half full or a glass half empty person, you might say that looks either like vomit on a page or Christmas wrapping paper. Those are the usual things that I get. And so it's hard to extract a lot of information out of that on its own. But if you zoom in and look at an individual cluster, you can really extract a lot of relevant information for public health. So there, in this picture here, you have a cluster. The size of the circle represents the viral load of the individual. If there's an outer ring around the circle, then that means it's a new case since last time. The color represents drug resistance. So if it's red, it means it's drug-resistant virus. If it's orange, it means it's intermediate. And if it's green, it means it's susceptible. In the top right, you have a graph showing the history of that cluster over time. And additionally, all of this information is linked to geography. So we can see that in that particular time period, this cluster was experiencing growth in Greater Victoria, Nanaimo, the downtown east side, and Kelowna. And so this is useful because, that those people that are in charge of looking after those areas might not know that there's these strong connections between those disparate places in terms of transmission. Next, I'm going to walk you through an example of the first intervention that happened as a result of this system. So back in 2014, we looked at cluster 55, we call it, and we noticed that there was a lot of new cases in that particular cluster in that 6-month period. And importantly, a lot of them have very high viral loads, and they also are drug resistant. So this is a very worrying problem. So the decision was made to do a formal outbreak investigation. And I'm not part of that part of it, but what happened was those people were contacted, they were connected to care, they were given access to treatment, and by the end, a number of them had started treatment again, or treatment for the first time. And you can see that when you look at it in the next period of time, all of those big circles have shrunk down, and there's only one new case that may have been somebody who was already infected and diagnosed at that point. So we observed a marked reduction in transmitted drug resistance, a large reduction in viral load of the cluster, and phylogenetics facilitated the prioritization and cost-effective delivery of connection to care for those people, HIV testing, enhanced partner care, and treatment. Another way that we've used this is to deliver PrEP. So originally PrEP was not necessarily palatable to the authorities because of the cost. And this provided a clear framework for identifying clusters of people that were at the highest risk. So we were able to offer for free phylogenetically targeted PrEP at no cost to people that were associated with clusters. So that's all great, but does it work? And so the question becomes, how do we evaluate that? And this is something that I'm working on. And this is just a plot showing in blue is the period when we first noticed a cluster, in orange is the subsequent year, and in red is the most recent year, 2017. And you can see that once we become aware of a cluster, in blue, it's big numbers, and then gradually the colors shrink as you go up. So, indicating that maybe this is helping us out. So here in BC, phylogenetics has proven to be an efficient way to identify populations at high risk of exposure, to target public health interventions, and now with the support of the Public Health Agency of Canada, we're currently offering this to the other provinces and territories of Canada. So HIV is split into a lot of different subtypes. And so you have HIV group M circled on the left there, and then that is split into a bunch of different subtypes, but you have a few other subtypes that are resulting from different cross-species transmission events from different primates. The HIV subtypes in group M is split into subtypes that reflect the migration of the pandemic across the continents. So in British Columbia, you can see we're largely orange or subtype B. if we build a phylogeny of all of the sequences we have in the database from Canada, we can build a Canadian picture of the epidemic. And then we can apply phylogenetic clustering to the Canadian epidemic as well. And you can see that here I've colored the dots, instead of by drug resistance, I'm now coloring them by the province of origin of the dot. And you can see that the big large clusters are primarily the same color, indicating that they're from the same province. But if you zoom in and look closely, you can still see that there is some exchange of HIV between provinces, despite the largely province-specific nature of the clusters. So you can see there's a yellow and red and green cluster there, which is Quebec, Ontario, and BC. So summarizing that, if you look at the clusters in Canada, you have largely province-specific clusters, but there is a substantial number of clusters that cross provincial boundaries. And interestingly, if we look at different provinces, the composition of the different subtypes in the clusters becomes different too. So this is just an example from Saskatchewan. The colors now represent the subtype of the virus. And in Saskatchewan, you have a circulating recombinant form, which is a recombinant of two different subtypes, forming a large cluster, and that's the AE cluster you see in orange there. The rest are mainly subtype B, like the rest of Canada. But you also have some subtype C clusters and subtype D clusters. So in British Columbia, we're fortunate. We've been monitoring our epidemic for a long time. We have a good idea already of clusters and where transmission is happening. But what if you apply this all of a sudden to a place like Saskatchewan, where you don't really have as long a history of close monitoring and the same knowledge of the depth of knowledge about the epidemic? How do you decide which of those clusters you're going to intervene on? So another thing we're doing here is developing methods for that. One way is to look at how quickly those clusters are growing. So you build a growth curve, and in this case, you've got cluster 8, 11, and 18, and all three of those clusters are growing extraordinarily rapidly. Like they've gone from, for instance, in the case of cluster 11, 0 in the beginning of 2016 to more than 20 people in 2017. So that's a very, very rapid growth cluster. And so if we intervene on those kind of clusters early, we can get that growth curve to taper off. Another phylogenetic method that we often use is diversification rates. And a very simple way of describing this is just the rate of splitting of the branches in the phylogenetic tree with respect to time. So in the clade on the left, you have a very rapid diversification rate. And in the clade on the right, you have a very slow diversification rate. And so we can combine those kind of rates with different kinds of sociodemographic variables, but also geography, to make inferences about what's happening to epidemics. So we can map them onto the entire phylogeny of Canadian HIV phylogeny. And here the colors represent how quickly the virus is diversifying. So if you have a blue color, a cool color, you have a slower diversification rate. And if you have a red or more orange color, you have a more rapid diversification rate. So now I'm going to take the map of Canada and I'm going to warp it by the number of HIV positive tests between 1985 and 2011. And you can see that BC sort of balloons out, and you can see that Ontario kind of balloons out, and Quebec kind of balloons out. But the center of the country doesn't really stand out so much. And next, I'm going to change the warping of the map of Canada by the diversification rate. And you can see that everything else shrinks, but the center of the country sort of balloons outward, indicating that we have a high diversification or transmission rate in that part of the country. So results from this part: most of the clustering occurs within provinces through local transmission. There's some interprovincial clustering. Most provinces contain largely province-specific clusters, and the large ones are dominated by injection drug use. And consistent with other evidence, Saskatchewan has had the highest rate of HIV diversification. Remaining challenges with this, our national level HIV phylogenetic monitoring system will be a global first of its kind as well. It presents a lot of other challenges that are involved with the flow of data across jurisdictions and things like that. But it's also an opportunity, and I like the fact that the country is working together to do this. What other parameters can we estimate using phylogenetics? One of them is R0, or the basic reproductive number. And this basically is the number where the number on average that one case, number of new cases that one case will give rise to over the course of its infectious period. So it's traditionally used to compare different viruses by how infectious they are. And we use a different class of models for calculating these things using phylogenetics called birth-death models. And this is an example of calculated basic reproductive number for the HCV epidemic in Egypt. And you can see that it corresponds very well with other information we have from that epidemic, that in the early 1900s, there was a massive uptick in the HCV infected population there. The viral affected population size is denoted by that quantity NE, and it's a quantity that reflects the number of infections giving rise to new infections at any particular point in time. So at time 1 there, you have a bunch of people, all of whom are infected with HCV. At time 2, though, you only have 4 people, and so only 2 people from time 1 are infecting people in time 2. So that means that the effective population size is 2 there. So we have been using Bayesian Skyline plots as well to represent this quantity. And here the y-axis represents the quantity NE, and the x-axis represents time. And so this is applied to hepatitis C spread in North America. So we were able to show using this method that HCV spread in North America about 15 years earlier than it was previously thought. So effective population size is another quantity that we can estimate using phylogenetics. Further use of diversification rates. Again, I'll remind you that this is the rate of splitting of branches in a tree with respect to time. And it can tell us where epidemics are increasing the most rapidly. And we can combine it with other attributes such as geography or socio-demographic variables. And so here I've combined it. I've aggregated the diversification rates calculated by a tree by the risk factors in the tree. And we can see that the diversification rate has been highest most of the most rapid transmission events have been happening in the EU population for this time interval. And the people who were infected by blood product infections, which is what BP stands for, were the slowest diversification rate. So if we combine it with geography again, so Canadian census tracts are small, relatively stable geographic areas that usually contain a population between 2,500 and 8,000 people. Due to the nature of their small populations, many census tracts have fewer than 5 people living within them, living with HIV in them at any given time. So publishing data for census tracts with less than 5 people that are infected could identify individuals breaching their privacy and confidentiality. So in order to get around that, what we've been doing is merging the census tracts until the numbers of people in the census tract are greater than 5. And this is graduate student Angela McLaughlin's work. And this is what she's merged the tracts into for Vancouver. And so now we're going to look at how, if we map the diversification rate into these census tracts, we're going to look at what it looks like. And you can see that Some of the census tracts that are colored in red have a very high diversification rate, and in panel A, panel B is plasma viral load, and panel C is HIV incidence. And so this is a method that she's been working on developing. And the next step is to take that and build a machine learning algorithm that is going to produce a predictive model for HIV incidence for these areas. It'll help us predict which areas are going to have higher HIV incidence in the future. Another thing that we're working on is that, well, the United Nations has similar targets for the elimination of HCV by 2030. And so we're working on developing a monitoring system for HCV infection hotspots. And HCV presents some different challenges to HIV because 20% of people are able to clear the virus, so that makes it harder to identify a transmission chain very clearly. At the same time, if you do identify a cluster, that is a conservative estimate of a cluster because you know that it has to be at least that big. What does all this mean? Well, in terms of phylogenetics and viral epidemics, it's a useful tool for viral epidemic monitoring. We've shown that we can estimate many epidemiological quantities in a purely quantitative framework based only on sequence data. So what I like about it is it doesn't involve information that other people write down on a form necessarily. You can just take the pure sequence data that's empirically derived and estimate these quantities. And it can be a very useful tool for public health resource allocation. You know, we often find ourselves in a situation where we have limited public health resources and we need to decide how are we going to deploy those on the landscape. This can provide us with ways of doing that. And these are tools that will help us to reach our 1990 targets by 2020. I want to say a big thank you to everyone in the lab. Many of you are in the audience here today. So this is the BC CFE Molecular Lab. A bunch of other people in the CFE, Center for Disease Control, Art Poon, Richard Harrigan, Sabrina Broom, and Julio Montaner. And I want to especially say a big thank you to the Public Health Agency of Canada for supporting the development of the national system and for recognizing the importance of the work, and all of the partners and other provinces that are participating. Thanks. I'll take any questions. Yep.
So have you been able to estimate incidence and prevalence, or at least the population that doesn't know that they have HIV in Vancouver?
So are you talking about estimating the unsampled fraction?
Right.
Yes. So yeah, that's something I'm working on. And you can think of it as if you have a model of a completely sampled phylogenetic tree, it has a certain structure. And you can identify the holes in that structure and by comparing what you have in your phylogenetic tree to what you would expect. And so that's a way of estimating the unsampled fraction. So yeah, it's possible to do, and it's something that I'm working on doing.
And can you connect the branching rate to the incidence rate?
Yeah. Yes. So that's Angela will produce a paper purely about that, actually.
Okay. Thank you.
Yep. Also, I'm going to go through 63 slides very quickly. That was 2 ways.
It was a good talk, though.
63 slides, I thought it was going to be too long.
Yeah, well, I don't know. I thought
It's short, 63 slides.
That's okay. Yeah.
Yeah, there's a actually,
I know.
thanks for your time.
Yes.
Oh, I should say we do need to say.
But when do the people go to the minutes, when we change the living cost
Oh, I see. Yeah. So that's unknown, right? That's partly why I had that law of the bar slide here.
Yeah.
Because it's showing, when you first see a cluster, you've got a big blue thing, and then after that, the second year it's usually orange, which is much smaller, but still not as small as 2015.
But so for here, when we were like we were going the next day,
yeah.
But do we know what their timelines are?
Yeah, it depends on that. It's very low. So, like, for instance, chance of wrong is like slight chance of cluster, and then there's just well, Vancouver also help there's a couple and contact that person. So that'll happen in case. But sometimes you can actually call that native person who's like their bodies get to take it.
And then so that is that with other provinces.
Yep. Saskatchewan is first.
We have all that.
Yeah, we have exactly for everybody except for Quebec. Yeah. So we're going to register Saskatchewan. It's very proactive and cheap. So yeah, very good reports, software, the other provinces.
More I see, the better I get it, the more questions I'll have.
I'm surprised there wasn't more people.
No one can. Like Chance mentioned in the lab, no one can see it.
Okay.
So that's what I'm going to do.
Yeah.
Like, who was supposed to
But he isn't up to advertise.
who does the
Yes.
should be something. But even if we know it's something from ourselves, we know the communications
Your call will be disconnected.